Ambient Assist has been a transformative addition to my practice. It has incredibly enhanced my workflow. With each upgrade, it gets better and better. It's more intuitive. I like that it is unobtrusive with another person in the room, that it really records the conversation and does not record personal things, only medical things, and then puts it into the components of the SOAP note, and as well as the assessment and plan, and then also will make suggestions on which labs and radiology, which studies to order, as well as suggest diagnostic codes. Really just a big help in every single way. It keeps me on time. I don't run behind anymore. I don't worry that if I don't get to finish a note that I'll be able to go back and finish it seamlessly in a few minutes or a few hours. So when you're looking at a patient, they're giving you body language, you have, of course, a better rapport, a better interaction, a better intuition of what is going on with the patient than when you're sitting there typing and then have to go do that. And I feel like a doctor again. I feel like a human being, not a data recorder. I really feel like this enhances the visit, and for why I went into medicine, because I enjoy relationships with people. And the computer and the documentation has sterilized that relationship greatly. And I feel that this has really, really changed my my whole work life. Well, there are some times where I make no edits at all, where I say this is totally fine, send to EHR, and then you have one more opportunity in the PAQ to review it. And if you say, oh, well, just got to add this little thing, but it's not many edits anymore. I feel like I'm not lingering after work getting my notes done, or even a lot of doctors have what's called pajama rounds, they call it. And basically that's after dinner, after kids, after everything you've done the day, you have to sit down at your computer and finish your notes and your all the stuff you have to do during the day. This really cuts that completely out. I would say there's no time that I've needed to do that. Also, it does allow you to see more patients. It allows you to see a full schedule every 15 minutes all day long, if that's the kind of schedule that you have, which is most physicians. But basically, it just really helps that kind of workflow. And I can only imagine that it's going to keep getting better and better. I'll show them, this is what we did today. It almost like review the note with them and, do you have any questions? But look at what it did. And now I'm going to send it to the computer and then we're done. And they said, wow, that's really amazing. I don't think I'm very technically inclined. So it can be done by anybody. I'm older. You don't have to be 20 or whatever, or 30 or 40 to figure it out. I mean, the tutorial videos are self-explanatory. The flow of the program is self-explanatory. And if there's any issues, we can always. NextGen is very responsive in getting back to you with any issues with the programming. The other thing is it gives you the whole mobile program. So if I'm out on my boat or wherever I'm at and I need to call Mrs. Jones, I forgot to call her, I can pull it up. I can send a prescription in for Mrs. Jones, and then I can do a job where I do the telephone message and it beams it right to the chart without even having to open my computer. So I may have access to a lot of things that I wouldn't have if I didn't have my physical laptop with me.